Do GLP-1 patches actually work? Do they help people to lose weight? That's what we're going to be having a look at in this video today. Hello, I'm Luke. I'm a health economist and a PhD student at the University of Oxford, and my girlfriend's recently sent me a TikTok of these GLP-1 receptor agonist patches. I've not heard of these patches before, and I do work in diabetes modelling, so I know a little bit about the therapies that are available. So I'm really interested to know what these patches are and the kind of clinical evidence that supports them. All right, so this is the video. Let's take a look.
Okay, apparently this is nature's Ozempic. They are patches that are science-backed and contain natural ingredients that basically are meant to keep you fuller for longer. I'm going to give these a go. They're just a patch that goes on a part of your body that has no hair, and you keep it on for 8 hours, and in that time it like slowly releases the vitamins that basically are meant to help curb your cravings. I'm very intrigued. I've got 3 months supply, but I'm going to report back after a week just to say how I'm getting on with them. Yeah, if anyone's tried these, let me know, because I'm so intrigued, and they're currently sold out. So
Okay, let's have a quick look on the website and see what we can find about these patches. Right, so I found the product that the lady in the video was holding, these GLP-1 patches. Currently sold out. They were retailing for £12, which is interesting because actual Ozempic retails for a lot more than £12 in the UK. So I'm interested to know what is in this. Let's go on to ingredients. So it says we've got this kind GLP-1 blend with a mixture of extracts, vitamins, and all sorts of other things. But interestingly, none of these things are GLP-1 receptor agonists. Okay, so this is not a GLP-1 agonist. GLP-1 patches does not contain synthetic GLP-1 and is not a GLP-1 agonist drug. Okay, so that's cleared that up. The branding maybe suggests otherwise, but let's see what the evidence is behind these patches, because just because it doesn't contain a GLP-1 receptor agonist, it doesn't necessarily mean that it doesn't have any benefit to weight loss. We've got here that at 1 month it will cause reduced hunger, and we've got participants in a clinical study using berberine reduced their food intake by 47.5%. This is the study that I found, and it mentions that this 47.5% food intake. The only issue that I've noticed is that this is in mice and not in humans. And similarly, this isn't through patches, but rather micro injections into the head of the mouse. So I'm not necessarily sure if this is generalizable to humans. Okay, if you scroll a bit further down on the page, past the reviews, you do come to this section, this frequently asked questions section, where they talk about the effectiveness of the GLP-1 patches. This is what we're looking for. So there's 2 studies for berberine, 1 study for L-glutamine, and 1 study for chromium. So I've just finished reading through the first study, and it's an N=1 study, which means it's one person recording the impact of an intervention on themselves. In this case, looking at the impact of 2-gram tablets of berberine on blood glucose levels. Whilst it does appear that it reduces the speed and peak of blood glucose levels after eating some carbohydrates, we need to remember that this is a tablet, it's not a patch, and it's in a far higher dose than what is being delivered through the patch. A similar conclusion is reached when examining the next piece of evidence for berberine listed on the company's website. This is a systematic review and a meta-analysis study, which means the authors have pulled together all the relevant studies across a particular time period, in this case 2005 to 2018. They've done this so that they can examine the effects that berberine has on obesity-related outcomes such as body mass index. As was the case with the last study, this meta-analysis is not examining patches containing 13.25 milligrams of berberine, pomegranate, and cinnamon extracts, but rather tablets of between 300 and 1,500 milligrams of berberine. Even if the patches were changed every 8 hours or 3 times per day as recommended, you'd only be around 13% of the lowest daily dose in this review. What does this mean? Well, it's highly unlikely that the patches will provide the same benefit as the tablets in this review. The final pieces of evidence that the company provides to indicate the effectiveness of their product are a pilot study of glutamine and a small trial of chromium. So, pilot studies are typically conducted to demonstrate that a clinical trial is worth funding. In this case, the trial only had a sample size of 6 people, and like the N equals 1 study from earlier, this is nowhere near enough people to suggest that glutamine benefits weight loss. The small scale randomized controlled trial of chromium not only is injecting mice with compounds again, but is also providing the human participants with doses 3,543 times stronger than the patch. I found this quite nice article on Healthline that sort of summarises a lot of the products that are available in these patches, and it sort of has this section on do weight loss patches actually work, and they talk about this animal studies demonstrated that it does seem to reduce body weight in animals, but there's not any studies really that are demonstrating that it has the same effect in humans. And it makes this really important point here, which is that ultimately these products are vitamins, these are supplements, and these don't have the same evidential threshold as what a drug like an actual GLP-1, like a semaglutide or an Ozempic, has to demonstrate. And as such, because these are marketed as supplements, they don't have to demonstrate that they work and they have the same effectiveness level as what a drug has to do. You know, this company does lots of different patches, and I imagine some of them are actually very helpful for people to get vitamins and whatnot. But the labelling, particularly of this GLP-1 product, is very, very good by the company. I personally think it is misleading. I think when you read GLP-1 patches, you think this is, you know, an actual GLP-1 drug. Obviously, it's very cheap, so it's not. But there's a lot of people that are clearly buying this product with the expectation that they're going to lose a significant amount of weight, more than likely. Quite a few people are suggesting that maybe it does help with cravings. You know, there are some problems here, and this is why a randomized controlled trial is really important, because there's lots of other things that could be affecting people's cravings. If you're assessing whether a product like this works in a population of people that are trying to lose weight, then they might be trying other things. They might be trying not to eat as much. They might they might be exercising more. They might be eating more whole grain meals, etc. But equally, there might be a placebo effect where people think this patch is having this effect, when in reality it's not, but you think that this patch is causing you to have a reduced appetite. So that's why having clinical trials of these sorts of products are really important if you genuinely want to see whether they work. But the current evidence is more than likely, you know, these patches, particularly in the dosages that are being delivered in a single patch, is unlikely to be having benefits in terms of sustainable weight loss for people. And equally, I very much doubt that it leads to the same benefits of actual GLP-1 receptor agonists. But this will be very cool one day if you know, pharmaceutical companies do manage to develop these types of patches or something like this, where they can deliver actual GLP-1 receptor agonists through patches. That would be very, very cool indeed.